You mentioned that you want to take a hypnobirthing class in preparation for childbirth, but the classes are all full. And that's very unfortunate, but there might be other classes offered in your area that you're not aware about, so check with your doctor's office or other hospitals in the area, and perhaps there will be one near you. If you're unable to find any classes, there are some things that I can tell you that will hopefully be beneficial to you throughout your labor and delivery process. You're doing well to want to prepare, because deciding today that you want to have an unmedicated delivery tomorrow is similar to deciding today you're going to run a marathon tomorrow. Of course, it's not going to go well because you have to condition yourself, you have to train and prepare. So that's the purpose of class. But again, with information I give you, hopefully you'll be able to prepare. It all comes down to basic breathing and relaxation, no matter what sort of program you look into. Lamaze, hypnobirthing, Bradley method, it all comes down to breathing and distraction. The types of different breathing and distraction you use just vary from program to program, but probably the line I use most frequently in my job as a labor and delivery nurse is take slow, deep breaths and reassure people that it's going to be okay and that they can do it. Because if you think about your natural response to pain, what are you going to do if you drop a hammer on your toe? Don't lie, you might swear, you jump up and down, you tense up, and when it comes to breathing, you do one of two things. You either hyperventilate or you hold your breath. Both of which aren't good for you because it messes up your oxygen and carbon dioxide balances in your blood if you're doing it for a long period of time. It can cause you to feel numb and tingly. It can cause you to pass out. And when the oxygen and carbon dioxide balances aren't right in your blood, it makes your organs not work as efficiently, including your uterus. And so you can work against yourself if you're not properly breathing during labor and actually halt your progress, which of course you don't want to do because you're feeling everything and you want it to go as quickly and as smoothly as possible. So the best thing you can do is take slow, deep breaths. Just in through your nose and blow it out through your mouth. And naturally, you breathe about 18 to 24 times a minute, and during a contraction, you want to slow your breathing down to about 12 to 14 times a minute, meaning you're literally just going to focus on slow, deep breaths. And if you focus on your breathing, you will be okay. People who exercise before they have a baby usually do really well during natural childbirth because they've associated movement with breathing before. Take a runner, for example. A runner who gets up in the morning to go for a run usually stretches, walks, jogs, and then runs. But you don't breathe heavily while you're stretching or walking. You don't start to breathe heavily until you're jogging and then sprinting. And of course, once you're jogging and sprinting, you start to think more about your breathing and how it coordinates with your movement, because you have to take in the proper amount of oxygen and blow off the right amount of carbon dioxide. So this process is very similar to going through labor. There are different types of breathing. For example, in the Moz, we teach the hee-hee-hooing breathing, and it's the kind that a lot of people make fun of in movies and stuff, but it can be really effective. I've seen it help a lot of people. When slow, deep breaths are even too much to do, sometimes if you just do the hee-hee-hooing, it keeps you on pace. I had a patient once whose husband just grabbed her by her face and said 1, 2, 3, and that coordinated with and he kept her paced through every single contraction during labor, and they bonded and they did well, and it was great for them. So when you're thinking about an unmedicated experience, there's a few other things to think about. In addition to breathing, you have to think about what kind of experience you want to have. You have to have a support person that's going to help you through it. Of course, this support person can be your significant other, but in some cases they're not there, or that's just not their cup of tea. So you replace them by bringing in a mom or a friend or a doula or something, but you do need someone who's going to help you with positioning and help you with breathing and remind you of different things you can try. Now, speaking of positioning and all of those other things, anything else you do during labor is simply distraction. So hypnobirthing is all based on thinking about what's happening to your body, and it's a script that you talk yourself through, or that you listen to, that you're thinking about while you're contracting. Lamaze is all about focal imagery, where you literally take yourself to another place in your mind, where instead of being in that room at that point having a contraction, you're in Hawaii on the beach experiencing all the sights, smells, tastes, and sounds of Hawaii. And so that's distracting you. I've seen people do something as simple as tape a Twix bar to the wall in front of them, and they looked at that every time they had a contraction, and they breathed through them, and that got them through to the end. So really anything can distract you. It just depends on which mode you prefer. You can also use touch and massage. Obviously, that's counteracting something painful with something pleasurable. A lot of people like their feet rubbed, or especially their back if you're having back labor. And your labor and delivery nurses can talk your partner or significant other through that. They can teach them massages that will be helpful to you. There's also scented oil. A lot of people experiment with that. There's certain scents like chamomile, peppermint, and lavender that have been proven to relax our senses. And so if you think of like a spa setting, it's got the perfect combination of lighting and sound and also scents that help relax us. And so that plays heavily into our emotions and your ability to handle pain. Music can help you as well. So Linkin Park may not be the best choice, but something more like new age music or nature sounds or something has gotten a lot of people through labor. And positioning is also very helpful. We all have experienced pain before and know that there are certain positions that are helpful and others that make it worse. And so when it comes to positioning during labor, it's very circumstantial. That's the most important thing I can tell you about that. Sometimes there are certain positions where you want to be in because it helps with the pain, but it's not right for your baby. For example, anything that happens with the placenta or umbilical cord will affect blood flow to your baby. So if the placenta or umbilical cord is being squished while you're in a certain position, then your baby will feel that and will see that because we're monitoring the pattern of the baby's heart rate. And of course, you want your baby to be well supported during labor. So let me give you an example. I had a patient a few weeks ago who didn't want to get an epidural, and the position she preferred was standing. And every time she stood, her baby's heart rate would go down. At first, I thought maybe this was just a coincidence, and so I let her have another contraction or two, and her baby's heart rate went down with each contraction. Well, the best position for a baby is on your side. That's how the baby gets the best blood flow, and it can vary from side to side. The left may be better at some times, the right may be better. Again, it depends on the location of the placenta and the umbilical cord. But we laid this woman on her side and she hated it. It was so uncomfortable for her. So I let her stand up again. And as soon as she stood up, her baby had a dip in the heart rate again. So it wasn't just a coincidence. The cord was being pinched somewhere and she had to lay on her side in order to support her baby through labor. So your nurses and doctors will tell you during labor what positions are going to be best for you and the baby, positions that are good for your comfort level as well as supporting your baby. So again, this is very circumstantial. I can't tell you all of the positions you could be in because it depends on how your baby's doing through labor. Now, this is another good thing to discuss when thinking about natural childbirth. There are actually times when your doctors or nurses will recommend an epidural, and it's only for two reasons. Two reasons only. Number one, if it's going to benefit you or it's going to benefit your baby. So keep an open mind. That's the best way to go into labor and delivery, because really, as much as we all want to have control over what's going to happen, we don't. The baby controls everything, and your body may do things that seem unnatural, but really it is natural because your body's doing it. It's just not following the course of labor and delivery like it should. Let me give you an example. So I had a patient once who wasn't getting an epidural, and she'd been in labor for like 23 hours. And at this point in time, she had been 7 centimeters for 4 hours. And that is not normal. That's not okay. You should be progressing about 1 centimeter per hour after 4 centimeters. But she was flitting around like the Pied Piper or like Lord of the Dance. And she was kicking me. She was screaming at her husband. At that point, he had kind of given up on her. She was out of control, hyperventilating, like past the point of breathing and relaxation. And so 99% of the time, I'm so nice to my patients. But with her, I grabbed her face and I said, we are going to talk about an epidural. So we talked about why she didn't want an epidural in the first place, and she was just afraid of a needle poke. So we talked about the basics of an epidural, and she decided to get one. And they take about 20 minutes to set up, and later, 20 minutes later, I checked her, and she was 10 centimeters, which goes to show that if you're not breathing properly or controlling yourself, you can be very counterproductive and your cervix won't change. So we encourage epidurals in those circumstances, but then we also encourage them sometimes for the safety and well-being of your baby. Many people are afraid of getting epidurals because they think that it will harm their baby, when actually it's one of the safest things you can have in place, because if you need an emergency C-section, our only alternative if you don't have an epidural in place is general anesthesia. And that's what you get if you go to the hospital and have your appendix out, where we put a mask on your face and tell you to count backwards from 10, and the last thing you remember is 8, and then you're out. In those circumstances, we have to put a tube down your throat and breathe for you. And the medication that we give to control your pain and knock you out for a C-section if you don't have an epidural does get to your baby, whereas the epidural medication doesn't. And babies born under general anesthesia sometimes need to be fully resuscitated after birth, and we don't like to do that unless we absolutely have to. We reserve general anesthesia for emergencies or rare situations only. So if your doctor suspects that you might need a C-section during the course of your labor, they might encourage you to get an epidural if you haven't already at that point. So the take-home message of all of this is that breathing and relaxation are a must when it comes to unmedicated childbirth preparation. And just focus on your breathing. Think of something that's going to distract you, all those different things we talked about, and come prepared for it. But also keep an open mind and talk to your nurses and doctor about what's going on during your experience, and they will give you good information and they will support you through it. They want you to be successful, and ultimately they want you and your baby to be healthy and well, which I'm sure is your goal too. Congratulations ahead of time, and if you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms, and recommend us to your friends and family too.